Hello, my name is Irene Brana from Valdebrón University Hospital in Barcelona, Spain. On behalf of my co-authors, I am pleased to present the results from a phase 2 study of the soluble LAG-3 protein eftilagimod alpha and pembrolizumab in patients with PD-L1 unselected, metastatic, second-line head and neck squamous cell carcinoma. Monoclonal antibodies targeting PD-1 have shown activity in recurrent metastatic head and neck squamous cell carcinoma. However, the response rate in the platinum-resistant setting ranged 13 to 17%. Eftilagimod alpha is a soluble LAG-3 protein constituted by the extracellular portion of the human LAG-3 protein fused to the Fc fraction of the human IgG1. Ft binds to the major histocompatibility complex class II from antigen-presenting cells, activating DREM and enhancing T-cell activation. The addition of Ft might increase the activity of pembrolizumab. The TACTI-002 study is a phase 2 non-randomized study to test the combination of Ft and pembrolizumab in patients with non-small cell lung cancer and head and neck squamous cell carcinomas. Pembrolizumab was administered at the standard dose and schedule and was combined with Ft, which was administered subcutaneously every 2 weeks for the first 9 cycles and every 3 weeks for 9 additional cycles. This presentation will focus on cohort C, which tested the combination of Ft and pembrolizumab as second-line therapy in patients with recurrent or metastatic head and neck squamous cell carcinoma regardless of the PD-1 status. All the patients had progressed to a platinum-based first-line therapy. The combination of Ft and pembrolizumab was well tolerated. Most AEs were of low grade and corresponded to well-known toxicities of pembrolizumab. Low-grade pain in the site of the Ft administration was also observed. There were no grade 4 or 5 toxicities. Only one patient experienced a treatment-related adverse event which led to treatment discontinuation. The characteristics of the patients participating in the study were the expected in patients with recurrent and metastatic head and neck squamous cell carcinomas. Table 5 reflects the best overall response by iRECIST. The overall response rate was almost 30%, with a striking complete response rate of 13.5%. The waterfall plot in Figure 1 revealed deep responses. In addition to the 5 patients with complete response, there were additional patients experiencing shrinkage of the target lesions beyond 50%. As depicted in Figure 2, the median PFS was 2.1 months in the general population and 4.1 months in the 24 patients with combined positive score CPS more or equal than 1. In the population CPS more or equal than 1, mean overall survival was 12.6 months and the overall response rate of the evaluable patients was 45.8 months. Figures 3 and 4 highlight the depth and duration of the responses. At the time of the data cutoff in April 2021, 9 patients, 80% of the responding patients, were still on treatment. In summary, from the safety perspective, treatment with Ft plus pembrolizumab was well tolerated with no new safety signals. This study showed encouraging overall response rate of 30% by iRECIST in unselected population, with a high rate of complete responses. Responses were deep and durable, and the median duration of response hasn't been reached yet. In patients with CPS more or equal than 1, overall response rate was 45.8%, PFS was 4.1 months, and median overall survival was 12.6 months. These results were encouraging compared to the historical data from the KEYNOTE-040 study. These findings support further investigation in patients with head and neck squamous cell carcinoma, and a phase 2 study evaluating Ft plus pembrolizumab as first line in patients with recurrent and metastatic head and neck squamous cell carcinoma has been initiated.